Good afternoon and welcome to our Academic Resilience Series. My name is Dr. Ann Gadino, here together with the program director of this series, Dr. Margaret Mabingio. We're so glad to have you back again for the fall of 2021 for this series. Today, we are so pleased to have with us Dr. Sara Gatumu, MD, psychiatrist. And if you tuned into the series last year, you heard Dr. Gatumu last year as well. She's so wonderful that she really caught our attention and we wanted to have her back. And we're so pleased that she is back. Dr. Gatumu is a psychiatrist with extensive work experience in both inpatient and outpatient settings with children, adolescents, adults, patients dealing with addiction. She pursued a psychiatry residency at the University of Pittsburgh Medical Center at Western Psychiatric Institute and Clinic, and then fellowship in child and adolescent psychiatry at Allegheny General Hospital. She has worked in multiple settings in Western and Central Pennsylvania for over 15 years. Dr. Gatumu received her training at the University of Nairobi, Kenya, where she practiced for several years prior to relocating to the United States. She received a master's in public health at Johns Hopkins Bloomberg School of Public Health. And perhaps our favorite credential is that Dr. Gatumu is right here in Lancaster, and she does work as part of Lancaster General Health. So without further ado, Dr. Gatumu, welcome, and thank you for being back with us.
Oh, thank you. Thank you so much. Thank you for inviting me, Dr. Video, to share some of my heart's desire for people and wellness right from the root, because we need to be addressing not just mental health, but total health from the root. So today we'll be talking about the pandemic and mental health. So how close to the cliff were we, or are we? I remember reading in a Reader's Digest years ago of a man who had put an advertisement in the newspaper. So in the advertisement, he wanted a chauffeur for his 3 children. And so in the advertisement, he gave a date for the interview, a time, a location, and what attire the people were supposed to wear and all of that. So he was very particular because the cargo that the person was going to be carrying was very precious to him. So definitely some people came for the interview at the wrong time. They showed up at the wrong place. Some showed up with the wrong attire, but there were 3 people who showed up at the right time, the right place, the right attire, and those were the ones who got the interview. So part of the interview was driving. And there was a nice car parked there near a cliff. And the owner, the one who wanted a chauffeur, told the first person, I want to see how close to the cliff you can park. That's a skill so that I can see how carefully you'll be taking care of my children. So the first man said, okay, I can do this. So he entered into the car and he reversed very, very close to the cliff, maybe like 5 meters from the cliff. And then he said that's where he would stop. The second driver said, oh, I can do better than that. And he drove he reversed very, very close to the cliff. And he was like 2 meters from the cliff. The third driver said, I think I need to park farther away from the cliff. So he was parked like 15 meters from the cliff. So of those 3 drivers, who do you think got the job? Number 1, 2, or 3? If you said 3, then you are right, because it's not just a matter of how close to the cliff are you parked, because whether there is a shaking right now or it's going to come, it depends how that shaking is going to affect you will depend on how close to the cliff you are parked. Now, with the pandemic, that was a big shaking. It has happened not only to us here in America, it has happened around the world. It has happened to all people, all ages, all denominations. And how close to the cliff are we? It determines the outcome of how we weather the storm. And of course, the government is doing all it can to help us with vaccines and immunization and things like that. But there are things that we can do ourselves to make sure that we park as far away from the cliff as possible. So when another shaking or when this shaking continues, we are parked farther away from the cliff so that we have a higher likelihood of surviving. All right, so let's talk about mental health now versus about 50 years ago. What has really changed? Most of you may not remember this particular family, but this was a show that we watched way back when, Little House on the Prairie. And the family structure has changed. Before, there was a stay-at-home mother watching the children, and the father was a working parent. So there has been a change in the structure of the family. Many times you find that both parents are out working, and so the attention being given in the home is not as it was 50 years ago. Another thing that has changed is the diet. Most of the people in this era were growing their own food. But now what we have is mass production of food. So we have mass production of crops, and all these fertilizers being used causes some of the fertilizers lock the nutrients so that they are not available to the food as it grows. And therefore, if you're eating a carrot today, it does not have the same nutrient density as a carrot back then. Another thing that has changed is the stress tolerance. Stress tolerance has really gone down, so that when somebody is under stress, they just break. They just break because they haven't developed the stress tolerance. One of the things that was there before the breakdown of the family structure is that when the children had something stressful going on, maybe somebody was being bullied at school, or they were feeling bad about themselves or something, there was a parent who was there, or a person who was there to tell the child what so that the child didn't have to deal with that stressful situation by themselves. And the parent or the responsible guardian would help the child, maybe through their own experience or through stories or through imagination, and help the child build that resiliency. So right now, the stress tolerance is low because of the different changes that have happened in the family structure. Social isolation. There was a lot of good social networks during that has changed over the years. People had your aunt or your uncle or your grandma who you could easily run to, and if you're not getting along with your mother, you could get along with your grandmother. So the social networks have really changed, and this does affect how people manage their stress. So there's also a lot of reliance on other people to help solve your problem. Instead of asking, what can I do to solve my problem? Many people ask, what can you do to help me? Now, there is a time for seeking for help, but because the people are already so fragile, the first sign of stress, they break, so they do seek for help, and we absolutely encourage that. But there has to be an increase in what can I do to put myself in the optimum state. And so those are some of the changes that have happened. Yesterday, I was listening to a lady who, she's probably in her 30s or 40s now, but when she was about 14, she was kidnapped, and she was kept away by these kidnappers for about 9 months. During that time, she was raped, and there was a lot of abuse going on. And one of the things that she said to herself that made her survive all that trauma that she experienced during the time that she was away was that no matter what, I know that my family loves me. No matter what happens to me, I know I still have somebody to go back to. And that is what pulled her through each and every one of those difficult days. She'd wake up in the morning not wanting to go on because she knew what was going to happen to her that day. But because she knew that there was somebody who was absolutely 100% loyal to her. She said, I will go on because I know my family is there for me. So having a loyal structure, a loving, loyal relationship, even if it's just one person, is one of the protective factors. And we'll talk more about the protective factors as we go. So where was mental health before the pandemic? How close to the cliff were we before the pandemic? Well, about 18 million adults with depression and about 2 million children with depression. Now, those are very high numbers. And when it comes to anxiety, it's about 40 million adults and 4 million children. All of these were people dealing with anxiety and depression before the pandemic. And these numbers have greatly increased. I don't have the numbers right now, but they have definitely increased. So what has happened after the pandemic? So there was an increase in isolation. We all experienced that. We could not go here, there, the travel restrictions and all of that. So there was a lot of isolation. Isolation, for us as human beings, we were not meant to be isolated. We were meant to do well in community. And so the isolation, although we do realize the necessity for the physical isolation, the social isolation is really very detrimental to mental health. The stress really increased not only for the children, but also for the adults. And when the adults are stressed and they can't handle their stress, it just goes over to the children. When there is financial stress, people losing their jobs, lack of the regular structures where the routines and the rhythms that were there before the pandemic, when those were lost, definitely that caused increase in the stress levels. The illness itself, now the COVID-19 by itself can predispose to depression. And this is in addition to other medical problems that were already there that could have predisposed to the depression. Death and loss of life, loss of livelihood, going for funerals every other time you're hearing of a funeral, all of this has really worsened the mental health for the community. So what are the predisposing factors to depression and anxiety? The first one, which is the most common one, which we probably all know about, is a genetic predisposition. When a mother or father has depression or anxiety, the likelihood of the next generation having depression or anxiety is actually increased. Sometimes when the mother is really anxious, her stress levels go up, her cortisol levels go up, and those levels of those hormones, they pass through the blood-brain barrier, the placenta, and they go to the baby, and the baby is born in a heightened state of anxiety, and they do tend to be more predisposed to anxiety and depression. And then on top of that, the mother who is anxious gives the baby the genetic predisposition, and then they model anxiety behaviors as the child is growing up. So that's a double whammy, and adverse childhood events. Usually these are physical abuse, sexual abuse, neglect, witnessing domestic violence in the home, especially if the violence is towards the mother. This can this is one of the big factors for predisposing to depression and anxiety in children. Witnessing somebody being taken to jail, witnessing a traumatic event in the community, those adverse childhood events increase the likelihood of somebody getting depression. And then if there are no protective factors, as we'll talk about later, then the child gets depressed. My youngest child who I have admitted as an inpatient was actually a 6-year-old little boy. And he was admitted because of suicidal thoughts. And, looking at the family as a whole, there was a genetic predisposition. He had been exposed to adverse childhood events. And so just giving him Prozac or Zoloft would not be the answer. We would need to have a more holistic approach to management of the depression and the anxiety. Then we also have medical illnesses like COVID-19, other medical illnesses, diabetes, thyroid disease. All of that can predispose to depression and anxiety. Some medications, some of the medications being given to treat other conditions, one of the side effects is depression. And a big one for individuals is personal turmoil. Whatever the stressor somebody is going through, whether it's divorce or redundancy, financial distress, all of these can be predisposing factors for depression. So what are the perpetuating factors for depression? Lack of sunlight. You probably are aware of the seasonal affective disorder, which patients have depression in the fall and the winter. And another thing that happens is a lot of people are using sunblock, which is good, but then it's also bad because you're not able to get as much vitamin D as you need to for your body. So lack of sunlight is a perpetuating factor for depression. Overindulgence in processed food. This one, we cannot beat it enough, you know. There's a sad diet that we have here in America. Sedentary lifestyle, lack of activity, riding bicycles, walking. Sedentary lifestyle is a perpetuating factor for depression. And of course, when somebody is depressed, some people will try to use drugs and alcohol to make themselves feel better, but this makes them the depression and anxiety worse. And you've probably heard in the news about the increase in the suicide rates and how the government is trying to step in to help people because of increased rates of suicide in the current context that we're dealing with. Chronic stress, when you can't see a relief to the problem, that chronic stress is a perpetuating factors. And I talked about loyalty and strong intimate relationships. If you don't have good, loyal, strong, intimate relationships, even if it is just one person, the likelihood of that depression becoming worse is very high. I just told you about the little girl who was abducted when she was either 13 or 14. And when all the trauma was happening to her, she knew in the back of her mind that no matter what happened to her, her mother loves her, her father loves her, and they're looking for her. So she would wake up in the morning, and she's giving a talk today, actually, I think in Elizabethtown. So she would wake up in the morning saying, I did not sign up for this. This is terrible. And it definitely was terrible. But she knew my mother and father, they're looking for me. My mother and father will love me no matter what. And having that loyalty, having that strong, intimate relationships with one other person or two other people in this world is a protective factor. Other perpetuating factors which we can do something about are inflammation, especially of the gut. You've probably heard a lot about the gut and the gut health. Gut health and mental health are very, very closely related. 80% of the serotonin in the body is actually produced in the gut. And so we need to have optimal health with our gut. Remember, we talked about the food that we're eating. The nutrient density is low. And so if you're eating food, even if it is organic, but the nutrient density is low, and then the gut is inflamed, that means the absorption is poor. Therefore, you're not getting what you need from the food. So gut inflammation is something that we can do something about. The gut microbiome are the bacteria in your gut, and that is something we can do something about. Now we are living in a world where there are chemicals everywhere. There are chemicals in the water, chemicals in the products that we put on our skin, chemicals in the air, the sprays that we spray. So there are chemicals and toxins. Now, all of these, when they're absorbed in the body, they are not neutral. They do affect the body, and this can be a perpetuating factor for depression. One that we've talked about a lot, especially with the generation right now, is the smartphones and the blue light and social media. Back in the about 50 years ago or so, news was not traveling as fast as it is now. And people are glued to their phones. What is so and so doing? So you're overstimulated and you're not relaxed, giving yourself a time to relax. And this is a perpetuating factor for depression and anxiety. And traumatic brain injury, no matter how small, this can be a perpetuating factor for depression and anxiety. It has been talked a lot about with the football players, but even riding your bicycle without a helmet, being injured, like somebody had a fall when they were a baby, they didn't realize that was a traumatic brain injury, and you're not doing anything to support your brain now. That can be a perpetuating factor for depression. The deficiencies which are associated with depression and anxiety are vitamin D, I just talked to you about, usually the D3. And when you take a supplement like Centrum or whichever multivitamin you're taking, it does have vitamin D, but the amount of vitamin D in the supplement is not adequate for patients who have a depression and anxiety. And at the end of this session, I will tell you some of the ones that I do recommend. The other deficiencies are vitamin B6 and B12, folate. Like vitamin D, vitamin B6, they are needed in a lot of the reactions going on in the body, moving from one place to the other. And if somebody is not having adequate of these cofactors, it increases the depression and anxiety. Now, with the amino acids, we're supposed to get this from our diet, but like I said, most of our diets are deficient, and so it would be a good idea to supplement this. The others are the zinc, magnesium, iron, and omega-3. These deficiencies are prevalent in patients who have mental health disorders. So what are some of the protective factors? Parental resilience. Now, when you're going through a difficult time as a parent, your children are also going through the difficult time, but how you deal with the situation may influence how your children are going to perceive that situation, how they feel during that situation. So if the parent has depression and anxiety themselves, they're not able to model a protective response. And so parental resilience is a protective factor. If you know that you've seen your parents going through a hard time and coming back up, the likelihood of you having the correct state of mind to come back up is higher. Social connections. Like I said, if you feel that you have a good social support network, one or two people who you know have your back no matter what, you don't have to tell them all your problems, but know that they have your back. And if you are in a situation that you know somebody would come and do everything they can to help you, having good social connections is protective. And knowledge of parenting of the child and the youth as the child is growing up. Positive attitudes and values. This may also have something to do with religion. If you know that you're not in this world by yourself, that there is a higher power who's supporting you and helping you, and you're not here by yourself, having a positive attitude and value is protective. Positive self-esteem. And this is not something that you just wake up with. It's something that we develop. And some of the children, especially when they are young, if they're in situations where the parent is not available, then they don't know how to develop their self-esteem. But when a parent is available to help the child as they go through difficult circumstances, it helps with the positive self-esteem. But as the teenagers are growing and as young adults, this is something that we can definitely improve on, and all of us need to be improving on our self-esteem as we go on. Then another protective factor is success. Like, say, for example, you succeed in something. So what happens is when you succeed, there is that release of dopamine in your body, and that it gives you a sense of accomplishment and sense of, I can do this, I can succeed. That is protective. And the availability of economic opportunities, that is also a protective factor for depression and anxiety. So when you go to your regular doctor for testing, if there is somebody who has depression or anxiety, there are some regular blood tests that we do. Some of the not so regular ones are the food sensitivities. And sometimes it's good to ask your provider to look into whether there is something you're sensitive to in terms of your diet. But if you want to do this by yourself, you can do an elimination diet and see step by step what foods you feel better on and what foods you don't feel as well on. Hormonal imbalances are usually a bigger problem, especially for middle age with obesity and things like that. But that can also be be something that we need to test when we're dealing comprehensively with anxiety and depression. So one day I was having lunch, and one of the hospital administrators came and sat where I was. And as he sat there, he said, "Oh, patient so-and-so has just left the hospital." And as he was leaving, he said, "Oh, I'll see you in a couple of months." And, I really felt sad when I heard that, because what he was saying is, I don't think you have actually helped me the way I need to. I am going, but I will come back because you have not addressed the problem that I have. So we need to be looking at the person as a whole. There is no person who just needs a pill. We need to address the person as a whole to help them come out of any situation of depression and anxiety that they are feeling. If you came to my house and you saw this plant, what's the first thing that you would think? Maybe you would think, does that plant need water? Or does that plant need sunlight? Maybe you need to put it where there is more sunlight. Or maybe you would think, maybe you need to put some Miracle Grow. Are there some toxins? But what happens is many times when somebody presents to the hospital, the first thing somebody thinks is, what medication are we going to give this particular person? Now, this kind of approach is actually very good for things like a heart attack or a motor vehicle accident. Something is broken and we need to do something right away. That approach is very good. But when it comes to chronic things like depression, anxiety, that approach can perpetuate the symptoms because you're just turning off the symptom and not addressing the underlying problem. There is nobody who has a Prozac deficiency or a Celexa deficiency. They have deficiencies in serotonin. They have deficiencies in the neurotransmitters. They have stress. They have inflammation. What can we do to address the person as a whole? When the person is really acute and they're thinking of killing themselves, or the depression and anxiety is interfering with their day-to-day life, definitely they need to be in a hospital and we need to be really aggressive with the medication, but we need to be looking at the person as a whole. So the neurotransmitters that are associated with depression and anxiety are dopamine, serotonin, and norepinephrine. And some of these are actually available in the food that we eat. So what are some of the things that we can do to help ourselves to increase these neurotransmitters in our own bodies? Like we talked about dopamine, which is one of the feel-good hormones. And there are foods that can help with increasing dopamine levels. And so eating foods can be very helpful. We talked about achieving a goal. Setting a goal and achieving that will increase the dopamine levels. Completing a task, like Sarah had said, I was going to do this walk several times around the block. When I complete that task, I do give myself a pat on the back. It does help with increasing the dopamine. And the self-care activities help to increase the dopamine levels. Exercise helps with endorphin, and this is one of the protective factors. It helps with improving depression. Laughing or watching a movie that you enjoy, with either by yourself or with other people, that improves the sense of well-being. Some of the things that increase the serotonin, we talked about medications. Definitely those, especially when somebody is very sick, they need additional help with mood stabilizers. But just taking a walk on a nice sunny day, mindfulness techniques like staying in the present moment, is one of the coping skills that we use a lot to help increase our serotonin levels. Going out in nature, just having marveling at the wonders of creation, meditation, deep breathing actually helps to reduce your anxiety because it affects the vagus nerve and reducing that hyperarousal. Then oxytocin is the love hormone, and that actually increases when there is socialization, when there is physical touch. Having an animal is actually very protective for depression and anxiety because it increases that oxytocin, it increases that sense of belonging. And one of the ones that I find very helpful is helping others. And today I was talking with somebody, and she's not in a good place herself. But I told her that all of us are one step ahead of somebody else. And if you just look for one person who you can help, that will help with increasing the oxytocin levels, and that will help you feel better. So when we're doing a holistic approach to management of depression and anxiety, we need to talk about detoxing. We need to talk about nutrition, having an appropriate nutrition for you. Fitness and exercise goals. We talked a lot about the chemistry and how we can optimize that. Cognitive training, that is some of the things we talk about when we are in therapy sessions. Training yourself to think differently about the situation you are in. The medication can help with increasing dopamine, serotonin, or epinephrine, but it doesn't change your thoughts. That cognitive training, CBT, DBT, all of that, it helps with improvement of depression. So now I'm approaching the end of my talk, and I had told you about some of the protective factors I help the patients I work with. If you Google Hardy Nutritionals, you will find that this is a company that had really worked and really done a lot of research on nutrients that are deficient in people with depression and anxiety. And the amount of the vitamin D, of the vitamin B6 and B12 in this nutritional factor is higher than in the regular Centrum and the other over-the-counter supplements that we use. Omega-3 supplementation, we are not getting enough from the food. So that would be another supplement that would help position the body in an optimum state. Probiotics, especially probiotic 10, if you just Google probiotic 10, giving the body the right bacteria is very protective. And then the essential amino acids. When people take essential amino acids, the non-essential ones are formed from the essential ones. And so the body is able to make up the non-essential ones. And so we give the body what it needs. And so we have to treat the person as a whole, put all the pieces together, the nutrition, the fitness and exercise, the chemistry, cognitive training, and detox. And, 94% of failure is due to not having a system. Have a system where there is some accountability. Have all of these things in place so that you can optimize your health and be able to face whatever shaking. Right now, we are coming through with the shaking of the world due to the COVID-19. And who knows what other shakings are out there. We need to position our bodies as far away from the cliff as possible. So that's it for my presentation. Are there some questions?
Dr. Sara, there's one question in the chat.
I can go ahead and read that for you.
Sure.
Here's the first question. Where does being perfectly content to live or not live on the day fit in?
I think what this person is talking about is radical acceptance. And in radical acceptance, it's where you accept the things that you cannot change, but you are responsible for the things that you can change. So unless there is a further clarification, being perfectly content to live or not live, as far as not live, no, I don't think we should be perfectly okay not to live. We are here for a purpose. As long as you have a pulse, you have a purpose. So if you're talking about radical acceptance, knowing that you're not here in this world by yourself, and that even those things don't make sense right now, they might make sense a little, but we have to hold on and seek additional help. But I don't think we should be perfectly okay not to live. That one, I do not agree with that.
Another question, Dr. Gatumu, can you see the chat, or would you like for me to read these?
Yes, with depression symptoms that get worse in colder months, do you have any suggestions on how to help with those feelings that trigger more with the seasonal changing? Now, remember, feelings always follow thoughts. So we need to be thinking about what are the thoughts that are prevalent during this time. We talked about positioning your body in its optimal health. For some of the patients whose depression really worsens in the fall and the winter, there is a seasonal affective disorder lamp. If you go to Amazon and Google that seasonal affective disorder lamp, we usually recommend that the person gets that, and depending on the strength of the lamp, you use it, from the end of October till mid-March. Because that's the depression worsens because of the sunlight. We need sunlight for normal activities. So with depression that gets worse in the colder months, do you have any suggestion on how to help with those feelings that trigger? So the help is get the seasonal affective disorder lamp, optimize your health with the nutritional factors that I talked about, get strong connections so that you're emotionally connected to a person, so that you know that you're not alone. For me, spirituality is also very important, so I know I'm not in this world alone. And just having that right frame of mind. Talk with a therapist. Having somebody who is outside your family who you can tell absolutely anything is also very protective. So somebody was asking about the radical acceptance, and that, I had just said, like a brief explanation is that this has happened. I cannot change it. I cannot change everything, but I can change something. And the only person I can really change is myself. Yesterday I was listening to somebody who was talking about PTSD, especially with the military. And he was talking about not post-traumatic stress, but he was talking about post-traumatic growth. Asking yourself, okay, this has happened. Who have I become as a result of it? What good can come out of this bad thing? So that was one of the concepts that we talk about in radical acceptance. How do we find this holistic approach? How do we construct it ourselves with healthcare professionals? What I would say is look for a provider who has an integrative or functional approach to management of health. Most of the people who are trained with allopathic medicine is you come in, you have a chest pain, I give you this medicine without asking the other factors around that particular situation. So you want somebody who's going to ask you questions related to you as a whole. What is your advice for college students struggling in a new environment? So we have all been in new environments, and I know that college students going through a new environment, remember, especially if you've come to the university from far away, and here you are, you're trying to find your footing in a new environment. Know that you're not alone. Know that you're not the first person who's going to struggle. Know that you will make it, and that you are a step ahead of somebody else. Like I told you earlier today, I was talking to somebody who's struggling herself, but I told her you are a step ahead of somebody else. And if you look for a connection, help somebody else in that new environment, you will find that your own dopamine levels will increase, your own oxytocin levels will increase when you're helping others, and therefore you will actually be feeling better yourself. What are some steps in which someone could take while going through grief in particular? there is normal grief, and sometimes this can last a lifetime. And we all have lost or are going to lose somebody in our lives. That is one thing that makes us all human. When you go to Walmart, everybody there has lost somebody. When you go to school, everybody there has lost somebody. So just knowing that I am not alone, this experience that I'm going through is not unique to me, actually helps. Like when people, I don't know whether you remember Rwanda, when there was this big fight and about 1 million people were killed. There was a fight between one tribe and the other. And so what they did was, the people who are in the camps, the actual numbers of PTSD and things like that were actually very low, because it was a shared loss. It was a shared experience. And when you realize that this experience that I am going through is not me alone, it actually reduces the stress that you're feeling. But if you think, oh, it's me alone, I could have done something different, why did this happen to me, what's going to happen now, when you have those kind of questions, it elevates your stress hormones, and the stress hormones, they are not good. They're good for a short time, but not for a long time. Give yourself a chance. I personally have been through grief with the loss of my father, and I think about him every day. But and I do allow myself to feel the loss. I allow myself to cry if I need to, but not to be, and I take that as a sign of knowing that he played such an important part in my life. It's not a bad grief, it's good. And I always think, okay, Daddy, I'm going to have such a good day today because I know that's what you would want for me. So just framing it in a positive way is very helpful. Question from a student: I am very antisocial and I like my life that way, but I am depressed. What is your advice? Being alone is not necessarily a bad thing. I know that there are some people who function very well by themselves, but I have given you some of the things that you could do to optimize your own body health, your own some of the things that you which I have found helpful. But if you are depressed, you're sleeping too much or too little, constantly poor energy, you're not performing academically, and it's interfering with your day-to-day life, you do need to have an evaluation. If you do need medication in addition to that holistic approach that I've talked about, then you would need to be evaluated and have some medication. And remember that some of the things that we go through are just for a short time. And sometimes people make very permanent decisions when they're going through a rough time, and that's the wrong time to make any permanent decision. What would you suggest to try for someone who has already tried medication, therapy, mindfulness, nutrition, but hasn't seen any improvements with depression? First of all, I would say that the nutrition that you're dealing with, maybe you need to have the tests so that we see that whether your levels are where they need to be. There are tests that we can do for the neurotransmitters. Just we need to have that tested to see whether that is adequately being treated. And if you're not finding any improvement with the depression, there are other things. There's a new technique called TMS, where the body is stimulated, the mind is stimulated, and it does help with depression. And the other one is ketamine. And so we have to get the test, get the baseline levels, and then don't give up. There is a way. And people have really done a lot. Like, President Lincoln, he was depressed, and he was still able to run 9 times and become a president. So depression is something that many people live with. It can worsen at some times and improve at others, but we never give up. Do you have any referral resources if someone needs help for someone going through? Talk with your college. Your university should be having a resource center for that, and and see whether there's something there. Dr. Godino said, about me deciding to make my daddy happy every day. In fact, I say, I'm going to make you happy today by being happy, Question from a student, please talk about illegal drugs and mental health. Yes, we had, remember one of the things I said about things that can perpetuate depression and anxiety, the illegal drugs. Some people use the illegal drugs. They have like a small, for a short time, you get an increase in the dopamine. But then after that, the dopamine goes so low that you need that hit again. The amount of dopamine that you get from a jog is not the same that you get from, say, like heroin or something like that. And if you get such a high dose from heroin, you're going to need to keep getting that. And that is where the addictive nature comes in, because your body is craving for something. It gets the dopamine too much, and then you're stuck. You can't do without the drugs, and that worsens the mental health. And that's why you find an increase in the number of deaths from illegal drugs, and that's not something that we want. Finding appropriate resources to help you when you're going through anything to do with illegal drugs, alcohol. And I know right now in Pennsylvania, marijuana has been made legal. I personally, I hesitate, but that's my own personal opinion, and I do not prescribe it. But for those people who are finding some benefit from it, we'll see how things go in the long term. I know quite a few people who found God, and their depression and anxiety was helped when other solutions didn't work for them. Is there anything you can mention about this? Yes. Remember, I talked about spirituality. I talked about knowing that you're not in this world by yourself, your thought patterns and your thought process. Remember, the human is made out of the spirit that lives in the body, and we have a soul. And so when we are talking about antidepressants and vitamins, all of that is addressing the body, optimizing the body. And if that body has been optimized, but the spirit has not been optimized, then people can have lingering symptoms of depression. So the aspect of spirituality it goes very, very well with optimizing your depression and anxiety. Forgiveness, gratitude, knowing that you can't do everything, and accepting your limitations, and being okay, just enjoying something here and leaving some things undone. You cannot do everything, and being okay, and knowing that God is watching over you, and whatever mess you have made, somebody has made a bigger one than you. That always helps me when I think about the messes I have made. I know somebody else has made a bigger one, so let me get out of this one. Knowing that God is with me and He's helping me no matter how the situation may look like. Yes, that is a big help for depression. Question from a student. Please let us know what particular organic foods can help with mental health, especially when you are struggling financially. Yes, this is a big one. I think that the amount that you're going to pay for the organic foods is it's going to be well worth it, but you're still not going to get adequate amounts. Remember, I talked about the nutrient density in the food, and so if you have to weigh where you're going to spend your dollars, I think getting the supplements would be the most cost effective, because you get the higher nutrients from those particular ones that I had told you about. But you're not always going to be this way. Remember, you're a student for a short time, and then after that you get your job. You begin to do your impact to your world. You will not always be struggling. We were all where you are, and things will get better. Things will get better. Question from student. I see others self-medicating with alcohol, nicotine, pot. they seem to be content with this. Is it okay? Or how should I help them? Well, right now, because you are not a therapist, I don't think it's, you're equipped to help them. Right now, it's good to actually be a little selfish and help yourself. And then you can refer those people to somebody who is more equipped to deal with them. Sometimes, there's a time, my daughter was in a similar situation. She was talking with somebody. I think the person had broken up with somebody, and then so my daughter was trying to help that girl. And so I asked her, when did you go to school to be a therapist? She said, no, but I have to help. He said, you're not equipped. You're not equipped to help that person. Why don't you give them my number? Why don't you tell them to go and talk with a guidance counselor? That's the best way you can help, because right now you are not as equipped as you think you are. And it is true, so there's a lot of increase in alcohol, nicotine, pot use, and helping people to change their decisions and their actions is not a small thing. It's not an easy thing. So sometimes it's good to be a little selfish and know that you don't have forever to also be a student. Focus on your schoolwork and refer your friend to somebody who can help them. Do you have any tips for those struggling with anxiety attacks in school? Oh, this is a good one. Thank you for asking that one. Yes. Now, you probably know about a nerve called the vagus nerve. The vagus nerve is, it starts from the basal ganglia, and it goes all the way. It goes all the way through the neck. It touches the heart. It touches the lungs and the GI. It's the longest nerve in the body. And when somebody is having an anxiety attack, they have palpitations, their heart is beating really fast, they have upset stomach, and their body is all jittery. And the nerve that is mostly affected is that vagus nerve. Now, how can we hack the vagus nerve so that it can calm down? And this is where deep breathing comes in. Sometimes when somebody is having a panic attack, they're breathing like, and that makes it even worse. So what some of the skills we talk about in helping patients with anxiety is you take a deep breath in and count 4, like 1, 2, 3, 4. You're breathing in, hold for 2 seconds, 1, 2, and then breathe out and count 8. So if you breathe in, count 4, then breathe out and count 8. So what you're doing is you're reducing the activity of the vagus nerve, and you can keep your eyes closed or keep them open depending on where you are. But when you do that deep breathing, sometimes even just touching yourself or touching a table, bringing yourself into the present moment helps to reduce that anxiety attack wherever you are, whether you are in the cafeteria, whether you are in the school, in Walmart, or driving and you start feeling yourself having an anxiety attack. That is a breathing technique that you can do absolutely anywhere. Breathe in 3, hold for 2, and breathe out and count 6. Or breathe in 4, hold for 2, and count, and then breathe out and count 8. The carbon dioxide levels in the body increase, and that also helps to reduce anxiety. Thank you for asking that particular question. I am always very excited about the vagus nerve and helping people to reduce their own anxiety wherever they are.
I think we can say that we are very, very grateful for the information we have received today. We want to thank you so much, Dr. Sara, for availing yourself. We are so, so grateful. And I hope that all of us have been able to get something they can do to improve their own mental health. And again, we are living in times that, a lot of people are struggling in a lot of things. And that's why this session, is really very important. And we are just so grateful that you found time to come. We want to thank you so much also for logging in. We are very grateful. These programs cannot be successful without your help, and we are so grateful. Thank you and have a good afternoon.
Thank you. Bye-bye.